When you get hurt, what do? Go to a hospital, of course, and get the proper care you need, right? But when you go to this hospital to get the proper care and you're hit with what it costs, it ends up costing thousands and thousands of dollars. Money that you don't have and a lot of other people don't have either. But this is what happens day to day to a person in the United States due to the expensive healthcare. And in order to combat this dire issue, there was a bill created called Medicare for All. Medicare for All is a bill that it was created in hopes of solving how expensive medical attention is in the United States. According to Congress.gov, it is supposed to ensure healthcare for all U.S. residency, automatically enrollment for those that are born and are of residency to the U.S., and that it would cover items and services that are medically necessary and are appropriate to maintain health. Another point that furthered on how beneficial it could be is the Physicians for a National Health Program organization, which furthers by stating that by eliminating waste and corporate profiting in healthcare, the bill would save hundreds of billions annually that could be invested in actual healthcare, resulting in better, more equitable health outcomes. But that doesn't mean that on paper it does sound good, right? But when you really look at it, there's some cons that come along the way. A major issue, though, that Medicare for All could help solve is how expensive U.S. healthcare is. Like I mentioned, many people are afraid to even go to a hospital and get the proper care because they don't want to be hit with how much it really costs. According to The Blade, the U.S. 2023 per capita healthcare expenditures in the country are estimated to be $13,402, and the U.S. health outcomes were dead last when comparative to 10 other countries, including the UK, Australia, Netherlands, France, Switzerland, and Germany. All of these big countries, and it's dead last. A Medicare for All health insurance system would eliminate the societal ills of the uninsured, the underinsured, and people that struggle financially due to all these medical bills they're being hit with and medical debt that builds up, which affects about 36% of Americans in this country. And the program could significantly lower healthcare costs. It would relieve the burden of small businesses and large corporations that pay for about 75% of health insurance programs for their employees. Again, like I mentioned earlier, though, while this all sounds good on paper, and when you look at the pros sound really good, right? But you have to then look at the cons of this bill. The cons can be very daunting because it means that in order to fund a type of bill and health insurance like this that could cover for all, the middle class would be taxed increasingly, and so would everybody else. The Washington Point delves into this further and how there would be longer waiting times for specialty care, because when you compare it to like Canada and the United States, that's what happens. And it requires the government to kick 181 people off their employer-provided insurance, 36 off their individually purchased policies, and 35 off their Medicare Advantage plans. Though I think this Medicare for All can still be beneficial to all if we just add more requirements out of it or try and attack the problem a different way as well. PubMed Central Medicare believes that Medicare for All will not be able to deliver on its promise of equal opportunity for the best possible health outcomes due to the wealth gap that is a societal problem. Even if everybody had the same health insurance, wealthy individuals will have better health outcomes, for health outcomes depend on more than just access to health care, according to PubMed Central. Another way to tackle these kind of problems could be making requirements from doctors, like the Market Watch suggests. Some solutions they came up with was changing reimbursement to reduce payments for procedures and tests, while increasing payment for robust primary care, to have drug companies not control finances, and that they don't pay for studies in academia. They stop advertising, and their contribution to private groups are transparent, because drug companies control everything. They branch out in all kinds of parts of the hospital and healthcare system. There should be quality indicators for both the doctor, and the clinical protocols must be vetted to present a more accurate and patient-centric way of working in the hospital, and more money and resources must be directed to be nutritional and lifestyle programs, and all doctors must receive proper training in these areas. Alongside Medicare, these kinds of solutions could really make a difference.